Okay, the topic of this class is management during the transition period to optimize health and fertility of dairy cattle. The transition period from the dry state to the lactating state in these dairy cows is surrounded by several changes that can impact the entire lactation of these cows. So during the dry period, um, you expect the cows to undergo apoptosis of memory tissue, memory gland cells, and the regeneration of the cells as they approach calving. The final development of the calf happens during this last 60 days of gestation. And because of these changes in calf growth and also the changes in the mammary gland and the onset of colostrogenesis and lactogenesis, the diets during the dry period have to be different, usually in the far off, which is in the first 4 weeks 4 weeks after drying off. Usually these diets are a little more fibrous with a little less energy and protein. And as the cows approach the calving, usually in the last 4 weeks prepartum, the diets are usually a little more rich in energy and protein. And in some herds, there is also the feeding of acidogenic diets or acidogenic salts to reduce the chance of hypocalcemia, for example. So because of these changes in diets, there are also group changes, and usually this is just to afford these multiple diets in the prepartum period. And obviously, as the cows are approaching calving, there are several hormonal changes that are associated with calving and colostrogenesis. In particular, for calving, is the decrease in progesterone and increase in cortisol and estradiol. And also, there is the increase in prolactin and so forth. And like I said, the colostrogenesis is critical prepartum and lactogenesis is critical postpartum, particularly because they result in an increased energy and protein demand for these cows. Um, and this increasing demand of energy and protein happens exactly during a time that the cow undergoes this decrease in dry matter intake, which is normal for all the cows, even the healthiest cows in the herd, to have this decrease in dry matter intake, usually in the last 7 to 3 days before calving. So because of this decrease in dry matter intake and because the dry matter intake postpartum increases, but not at the same speed as the requirements for milk yield or for milk production, then the cows end up going through a change in body energy reserves. They end up using energy reserves to produce the milk that they are selected to produce, despite not eating everything. So it's obvious that this body energy reserve change is expected. It should not be dramatic, but it's expected. Remember that when we evaluate body energy reserves on farms, it's usually a body condition score, which is subcutaneous fat. The mesenteric fat actually is the one that changes more dynamically and has a bigger role in the metabolism. The other challenge here, beyond the increasing milk yield and this low dry matter intake, is that we want to establish pregnancy somewhere around 3 to 5 months after calving for these animals. And so anything that goes wrong during the transition period can have a significant impact on the likelihood of establishing pregnancy. And obviously, as the lactation progresses, the milk yield goes down. And even though the dry matter intake reaches a peak, that's close to when the peak of the milk happens, the drop in dry matter intake is not as steep during the lactation. And therefore, the cows can recuperate some of that body energy reserve that was lost in the beginning of the lactation. So the goals of the transition period are to make sure that the cow has a functioning immune system, in particular polymorphonuclear leukocytes, macrophages, that are the first line of defenses against contamination of the uterus, mammary gland, and so forth. We want to reduce the likelihood or the morbidity and reduce the risk of hypocalcemia, because hypocalcemia is a predisposing factor to immune deficiency. And we know that immune deficiency is a predisposing factor to retained placenta, metritis, and mastitis. And also, we want to reduce the risk of displacement of abomasum, which is an important disease usually associated to other diseases. Usually, we consider DA a secondary disease. In herds that are non-monitoring disease as well, we can evaluate the transition period by looking at the survival of cows beyond 60 days in milk. So if we have more than 94% of the cows surviving beyond 16 days in milk, 60 days in milk is a good sign. The other thing we can evaluate is peak milk. We want to see cows with high peaks of milk. And the reason for that is that some estimations say that for every 2.2 pound increase in peak milk, there is an increase in total lactation production of 440 pounds. So imagine that a cow is peaking at 10 at 80 pounds and another cow is peaking at 90 pounds. Well, this cow that is peaking at 90 pounds could be producing as much as 2,200 pounds more of milk in the entire lactation than the cow that is peaking at 80 pounds. So it's important that peak yield is also observed and evaluated in these herds, and we want to maximize it if possible. The other thing that we're trying to establish is pregnancy, like I mentioned before, and hopefully in after the first or second service, we want to produce a live calf. We want to have less than 5% stillbirth, and we want to have colostrum of good quality, okay, with more than 50 grams of IgG per liter and the Brix of greater than 22. So a summary of key aspects of management during the transition period are: we need to select sires to breed heifers and even cows that will afford calves that are not too big. So we need to look at calving ease of the sires. We need to make sure that particularly first calf heifers are achieving the correct size by the time that they're calving. Otherwise, we're going to compromise their health and their survival. And we need to monitor the prepartum pen, the close-up pen, so that we can assist in any calvings that are about to happen when necessary. We need to make sure that prepartum and postpartum, all the cows have access to feed and water, and they have easy access to feed and water any time of the day they want. Okay, so they need to have plenty of access to feed and water. We need to balance the diets well. So this is a picture from Mike Hutchins, kind of showing what you would expect in the rumen. The top layer with a lot of fiber, the medium layer here more with liquid, and the bottom layer more with grain. So you want to make sure that the diet of these prepartum cows and postpartum cows has sufficient fiber to stimulate the rumen, but at the same time, you don't want to have excessive fiber to the point that it limits intake. Okay, so it's kind of a delicate balance. Comfort, we need to provide as much comfort as we can to these cows with lying surfaces, dry lying surfaces, comfortable bedding, and also reduce heat stress. We want to make sure that we group the cows by parity. So we separate heifers from cows because heifers will tend to suffer bullying from larger cows, and that can actually compromise the intake of the heifers. We want to have simple and objective monitoring, okay? You don't want to make a monitoring program of transition cows so complicated that you actually cause more harm than good by keeping the cows locked up for too long just so that you can do the assessments that you want. We want to have aggressive reproductive management of these cows as soon as they come out of the voluntary waiting period, and I'll explain to you why in a minute. And we want to analyze data, okay? If we don't analyze data, we cannot help the dairyman to understand where opportunities are being missed. Okay, so one of the things that we care about is prepartum dry matter intake. And in this case here, I'm saying if you're designing a diet that the cow is supposed to eat 13 kilos of dry matter per day, that is the management you were doing in these transition cows has to be so that they meet this expected intake, okay? That's all that I'm saying. We need to manage them so that they reach the prepartum dry matter intake that we expected them to do. Prepartum dry matter intake is associated with peripartum immunity and postpartum dry matter intake. Okay, so if the prepartum dry matter intake is associated with postpartum dry matter intake, we know that cows that have excessive um, energy deficit in the postpartum, they also have compromised immune function. We know that cows that have compromised immune function are more likely to have retained placenta, metritis, mastitis, pneumonia. We know that the cows that have low postpartum dry matter intake are more likely to have low milk yield. And also, if the cows have low dry matter intake postpartum, they are more likely to have severe negative energy balance. And if they have severe negative energy balance, they're more likely to be anovular, they are less likely to conceive, and they're more likely to have pregnancy losses. Therefore, they are more likely to have low pregnancy rates. So we know also that diseases affect postpartum dry matter intake. And we know that diseases have a direct effect also on anovular conditions and other repro outcomes. And we know that a cow that has diseases produces less milk. And we also know that a cow that doesn't conceive soon enough will end up having a lower milk yield average in their lactation, and therefore they'll be less efficient, okay? Because they'll stay in the lower efficient stage of the lactation curve for longer because they didn't conceive soon enough. So you can see that everything is intertwined. And then finally, if we have more disease, less milk yield, and less or lower pregnancy rates, we're more likely to have culling. And obviously, low milk yield and more culling result in less profitability. So you can see that at the end, the culling and the profitability, or the profitability of the cow, depends a lot on what's happening in this transition from the dry period to the postpartum period. Okay, so challenges to the innate immune response in the periparturient period. Well, first of all, is that we have to keep in mind that one of the most important cells, immune cells, to prevent diseases in postpartum cows are macrophages and polymorphonuclear leukocytes like the neutrophils. And the neutrophils are important to break the linkage between the caruncle and the cotyledon. It produces collagenase, which is an enzyme that breaks the collagen that links the two structures. So if there is no active neutrophil, there is no collagenase, there is no breakage of the collagen, so the cows are more likely to have retained placenta. And also, what happens is that after calving, close to 90% of the cows have some sort of contamination of the uterus because they're not calving in a completely sterile environment. But luckily, about 10 to 30% of cows only develop metritis. It's because the majority of the cows have well-functioning neutrophils that that kill the bacteria before they have a chance of establishing infection and causing actual metritis. So what are some of the things that affect the neutrophil function or the polymorphonuclear function? We know that lower intake of dry matter is a problem because usually with lower intake of dry matter, there's less glucose, which is an important energy source for the functioning of the cells. There's less calcium that is critical for the proper function of the cells. There is more non-esterified fatty acids and beta-hydroxybutyrate. And these two substances alter membrane stability and membrane fluidity, which is somewhat associated with the ability of these cells to remodel and, for example, engulf bacteria in the process of phagocytosis. And then there's also a lower IGF-1, insulin like growth factor 1, when there is low dry matter intake. And this is a critical substance for cell differentiation and function. So with lesser or with less concentration of this substance, also there's less activity of these cells. Cortisol then is something separate from the dry matter intake, but if we manage cows in a way that it's stressful, we increase cortisol beyond an acceptable level and cause disruption on the ability of these cells to migrate from the capillary veins into the site of infection. And obviously, like I said, if stress is too much, that it's even a bigger problem. And heat stress has a direct effect on neutrophil function, but also can affect neutrophil function through a decrease in dry matter intake. So you can see that there are several issues here that we have to think about when thinking about the function of these cells. Okay, so if dry matter intake is so important for all the reasons that we just discussed, what are some of the things that affect dry matter intake in the peripartum period? So this is data from 16 experiments in Wisconsin, about 700 cows. And the idea of this experiment was to evaluate the factors associated with animals, like gestation length, how close they were to calving, the parity and body condition score, and the dietary factors like net energy for lactation, rumen degradable protein, and so on, that were affecting or were explaining the variability in dry matter intake. So what you see in this graph here is the variability in dry matter intake. So not explaining any or almost no association to very highly associated. And the thing that better explains the variability in dry matter intake or the variation in dry matter intake is how close they are to calving. Okay, it's exactly what I mentioned before, something that we cannot control. The other thing that is very important is how much fiber is in the diet, how much neutral detergent fiber is in the diet. So the more fibrous the diet is, the more variation you can find on dry matter intake of these cows. And then the next things are parity and body condition score. Obviously, parity we cannot change, but body condition score is something that we can try to manage. And so let's look at body condition score here. Since I'm not a nutritionist, I'm not going to talk a lot about the NDF issue. So here's what they say or showed in this experiment here. They classified the cows into thin and moderate body condition score and fat, okay, high body condition score. Here you have 21 days before calving all the way to calving. And here you have dry matter intake that goes from 1% of the body weight to 2% of the body weight. And so what you see is that the thinner and moderate cows are consuming more than the fat cows starting already at 21 days before calving. And more when they approach calving, the cows that are thinner and have moderate body condition score, they don't drop the dry matter intake as steeply as the cows that are fat. So one of the primary things that determine whether a cow will eat or not in the dry period is how fat they are when they go dry or when they start the close-up period. And that's really important, okay? And there is a significant connection between this body condition score at dry off and what happened to the cow in the previous lactation. At least we believe so. So what are the associations between body condition score loss in the dry period and performance? So this is data from 16,000 lactations, 10,000 cows in 2 farms in California. And the idea here was to determine how changes in the body condition during the dry period would affect or be associated with health, reproduction, and production. And also, we wanted to evaluate what factors were predicting body condition score change in the dry period and body condition score at dry off. So first things first, you have here the number of lactations, and then you have body condition score at dry off on the top here, and body condition score at parturition. You can see that at dry off, you have a lot of cows between 3 and 4.25 body condition at dry off. And when you look at the parturition, the majority of them are between 3 and 4, maybe 3, 3.75. So the message here is that a lot of the cows that are drying off above 4, they are shifting to the left and populating more these classes of 3.75, 3.5, 3.25 body condition score. So when we classify the cows as extreme body condition score loss, gain body condition, moderate loss of body condition, and no change, what we see is cows that had excessive loss were dried off at about 4.1 body condition and calved at about 3.25. Cows that had moderate loss of body condition dried off around 3.75 and calved at around 340. Cows that had no change dried at 3.5, calved at 3.5. Cows that gained dried at 325 and calved at around 3.6. So it seems that independent of what the body condition score of the cows was at dry off, they're trying to reach a similar body condition at calving of approximately 3.5, perhaps. Okay. So it seems that there is at least in this group of cows, some sort of genetic predisposition to calve at about 3.5 body condition score. So, what are the consequences of losing a lot of body condition score? So, losing 0.75 unit or more, losing zero point 0.5 to 0.25, and then not changing and cows gaining body condition score. So, a quarter change in body condition score is equal to approximately 40-pound change in body weight. Okay. So we're talking about cows losing here 120 pounds or more, cows losing about 80 to 40 pounds, cows not changing, and cows gaining body condition score and weight. First thing is that we see that uterine diseases are more, have greater incidence in the cows that lose body condition score than the cows that gain body condition score. No changes in metabolic diseases, but you look at indigestion, it's a greater incidence on these cows that had moderate change and no change versus the cows that gain body condition score. And what's important here is that the use of antimicrobials and anti-inflammatory drugs and supportive therapy was greater for the cows that lost body condition and had no change in body condition than the cows that gain body condition score. So the cows that lose body condition score, they end up having more diseases and they demand more treatment from the herd than the cows that are gaining some body condition score during the dry period. When we look at pregnancy fertility outcomes, here we have that cows that lose excessive body condition score, 21% are pregnant 75 days after first AI. Then we have 28% of them pregnant if they have moderate loss, 33% when they have no change, and 42% pregnant when they gain some body condition score in the dry period. Okay, and you can see that pregnancy losses from 38 to 75 decrease as the cows are gaining body condition score. It goes from 16% loss to 4.5% loss of pregnancies. Same thing happens for second postpartum AI. You have a pregnancy at 75 days of 22, 27, 29, and 36, and losses that go from 11 to 4.4%. So a cow that gains body condition score during the dry period is a cow that is more likely to conceive to first and second inseminations. And what's more, their overall production in the lactation is greater too. You see that the average production of cows that had excessive loss was 39%. Cows that had moderate loss was 40, not percent, 39 kilos, 40 kilos per day, 41 kilos per day, and 42 kilos per day. So you can see that not only cows that gain body condition are more likely to conceive, they also have quite a bit more milk yield per day than the cows that lost excessive body condition score or even moderate body condition score. Okay. So the message is the cows should not be losing body condition score during the dry period. Now, what explains the change in body condition during the dry period? 95% of what we can explain is explained by body condition at dry off. And the association here is this. Let's imagine that gaining body condition score is the ideal. So we have 0 probability to 100 probability or 1 probability of gaining body condition in the dry period. You see that a cow that dries off at 5 body condition score, she has basically 0 probability of gaining body condition score in the dry period. A cow that dries off at about 3.5 body condition score, she has about a 10% chance of gaining some body condition in the dry period. A cow that dries at 3.25 have about a 25% chance of gaining body condition in the dry period, and that continues to increase as the body condition at dry off decreases. So if we had to choose a body condition that is associated with a greater chance of gaining body condition in the dry period, it would be 3.25. So we would want the cows to dry at 3.25 or less so that their chances of gaining body condition in the dry period increases. You don't want the cow to be drying off at 2 or 2.25 or 2.5 because it's unlikely that this cow is going to gain sufficient body condition during the dry period to calve at a good body condition and avoid some diseases associated with very thin cows. So the other question that we asked in this study was, what is the ideal body condition score at calving? So if we decided that gaining body condition is a good thing, right, during the dry period, we decided that gaining body condition is a good thing. Now let's look at the cows that gain body condition during the dry period, and let's see what's the ideal body condition at freshening. 3.25 or less, 3.5, 3.75, and then 4 or more. And we're looking at morbidity, removal from the herd, days open, and milk queued. And what you see here is that calving too skinny, 3.25 or less, these cows end up having greater morbidity. They're more likely to be removed from the herd, particularly than the cows that are 3.5 and 3.75. They're not different than the cows that are fatter. And also what you observe is that the cows that calve too thin, 3.25 or less, they have greater interval from calving to conception, 103 versus 95 versus 96. But the fat cows are not different than the other ones. So if we look at morbidity, removal from the herd, and days open, we would say that probably calving at 3.5 or more would be ideal. But when we look at the milk queued during the lactation, we also see that the cows that calve too fat, they have lower production than the cows that calve at 3.5 and 3.75. So if we had to choose anything, we would say the cows should gain some body condition score during the dry period. So they should be drying off at 3.25 or less, and they should be calving at 3.5 to 3.75. That would be the goal. So as long as cows gain body condition during the dry period, body condition at 3.5 to 3.75 seems to be the ideal to improve performance. So what are the limiting factors to dry matter intake during the prepartum period? Animal factors: proximity to calving, parity, body condition score, and locomotion score. Lame cows will approach the bunk less often, so that's also a problem. And dietary factors are nutrient fiber and physical effective nutrient fiber, crude protein, and ether extract. And environment: temperature, humidity index. We know that heat stress reduces dry matter intake of these cows. So by having an aggressive reproductive management, it's really important because if we have delayed conception, we have a prolonged lactation. And when we have a prolonged lactation, we have elevated body condition at dry off, right? Because the cows stay in the lower production phase of the lactation for longer. They're still eating a lot, so they gain body condition score. So if they dry off at high body condition score, they lose body condition in the dry period. And if they lose body condition in the dry period, they have poor health. And if they have poor health, they have delayed conception. So it's a vicious cycle that we need to break by making sure that they conceive as soon as possible, or in the ideal interval, preventing these very long lactations that can result in very fat cows that dry off. So the ideal interval between calving and pregnancy depends mainly on milk yield and lactation curve persistency. In the US, in general, we would say that first lactation cows should conceive at 130 to 150 days after calving, and second lactation and greater cows should conceive at 100 to 120 days after calving. Okay, so that's what you have to keep in mind. Okay, so some of the other things that are associated with dry matter intake and production that we haven't discussed yet. This is an observational study from Canada, from Canadian herds. and you see that you have herds that are relatively small, okay? They have an average feed bunk space of 21 inches, going from 14 to 39 inches per cow. So what are the things that were associated with dry matter intake? Milking frequency. The herds that have 3 times a day milking versus 2 times a day milking have an increase in dry matter intake of 3 pounds per day. And feeding frequency, when the herds feed twice a day versus once a day, there's an increase in dry matter intake of 2.6 pounds. So those are important things that are also associated with dry matter intake. Management associated with milk yield, milking frequency. If you are milking at 2x, but you increase to 3x, you increase the milk yield by 13 pounds per day. Feeding frequency, if you're feeding at once a day versus, and you increase to twice a day, you increase milk yield by 4.4 pounds per day. And what's really cool in this study, in this epidemiological study, is that it's one of the only ones that looked at how much linear water trough space there was. And what they found was that for every 0.4 inches increase in linear water trough space, there was an increase in milk yield of about 0.85 pounds per day. So you can see that by providing fresh feed more often, and by providing a lot of water and access to water, these herds actually end up having greater dry matter intake and milk yield than the other herds. So some of the ideas here about feeding frequency, how would that benefit dry matter intake and milk yield? Dry matter intake is difficult to say because in some of these studies, increasing feeding frequency doesn't necessarily increase dry matter intake. But what we observe here is that when you have once a day feed delivery, you have, once you deliver the feed, 60% of the cows in the manger, in the feed bunk, and then that decreases and stays relatively stable throughout the day. But when you have twice a day feeding, you have a peak of cows coming to the bunk when they're fed for the first time. Then it stays more constant. And then when you fed it from the second time, you have again an increase in access to the feed bunk. So the idea is that by increasing the frequency of feeding, you provide fresh feed more often, and you stimulate those cows to get up and approach the feed bunk, and hopefully, in some cases, increase dry matter intake. The issue of feed bunk space is also associated with the access of these cows to the feed. And here in this study or this experiment, what they have is cows with 31.5 inches of feed bunk space, 23.6, 15.8, and 7.9. So here you have percentage of cows feeding throughout the day, and you can see that they're feeding twice, right? You have fresh feed here and fresh feed here, and you have the other events during the day. Here then we have that cows that are at 31.5 inches of bunk space, you have that about 80% of them and about 70% of them approach the feed bunk and are feeding when fresh feed is put out. When you have 23.6 inches, this pattern doesn't change much. You have about 80 and 70% of the cows approaching the bunk when fresh feed is put out. And then throughout the day, they remain relatively constant and about below 30%. But when you start limiting feed bunk space to 15.8 inches per cow, you can see that now instead of having 80% of the cows eating, you only have about 50% of the cows eating. And again, instead of having 70% of the cows eating, you have about 50% of the cows eating. What's more is that in the middle of the day, the cows that were limited to the feed bunk here, the access to feed bunk, they do not have compensatory approach to the feed bunk because these are herd animals and they do not want to be singled out. Okay, so even when you decrease the bunk space to 7.9 inches per cow, and you decrease the access of feed from 80% of the cows to about 30% of the cows, and from 70% of the cows to 30% of the cows when the fresh feed is delivered, you see that throughout the day, the cows do not go back to the bunk to compensate for the inability to access the fresh feed. Very likely, we believe that because cows are herd animals and do not want to be singled out and be standing there feeding alone. Okay, what else? So we just talked about access to feed and water, stocking, competition, dominance, and then frequency of feed delivery and push-ups. Those are critical things associated with dry matter intake of these periparturient cows. So the goal really of managing transition cows is to provide them with a clean environment, very comfortable bedding. Here you have the cows returning from the parlor and they're locked up to be inseminated, but you want to keep them locked up for a very little time, as little as possible, and then let them do what they're supposed to, which is rest, drink water, and play. Again, providing always good quality feed. And here you have a herd in Israel where they have a loose housing system, and you can see that the cows are lying down comfortably. You do not want to have small cows competing with large cows for the feed bunk space, and you do not want to have severe overcrowding to the point that a few cows will have limited access to feed. So here you have cows then that are returning to from the parlor here. You can see that because feed is in front of them, they immediately come and lock up to start eating, okay? That's the idea, that's the goal. You wanna have cows with always access to feed. So we'll talk about managing the transition cow and what happens on farms, and some people's concerned about regrouping of cows. This is actually the profile of a large herd that I work with in Minnesota. You have one barn here. This is all one barn, that you have the parlor here, and then you have the close-up pens. And so this is a cross-ventilated barn, and the exhaust fans were on this side, so they're sucking air through, and the air is going from the right to the left. On the other side here, you have another low-profile barn that is also a cross-ventilated barn, and here you have large pens of basically lactating cows. And in this case, the air is moving from the left to the right because the exhaust fans are on the very right side. And this herd also had a barn of naturally ventilated barn that had pens for far off heifers and far off cows. What I wanted to point out here is what normally happens in large herds. Far off cows and heifers are moved to the prepartum pens about 28 days before calving. As they're about to calve, they're moved to a maternity pen where they stay for about 24 to 12 hours, after which they are moved to a hospital pen because they are not supposed to be milked in the tank for milk that is going to be sold, because the colostrum is not to be sold for human consumption. And usually we say that the cows have to be milked 5 to 8 times before they are allowed to go into the bulk tank for selling it to public. From the hospital, they go to a postpartum pen, which is a pen that we have more intense monitoring of the cows to diagnose diseases like metritis and displacement of abomasum. And then 21 days after calving, they are moved to the breeding pens because usually after 14 to 21 days, the risk of diseases is much smaller. But the issue here is that you have 5 pen diet moves within a 50-day period. The diet change is of importance, but I do not believe that the pen movement is as important as some people make it. So what is really important is providing the cows enough time to do what they like to do. And prepartum cows like to be lying down for about 13 hours per day. And as they approach calving, that goes down. And when you look at mature cows, prepartum, they like to be eating for about 5 hours per day, and first lactation cows about 4 hours per day. The postpartum cows will change a little bit. They may be lying down for a little less and eat for a little less time, but it's still pretty close. So the idea is that we need to provide them with time to do what they're supposed to do, what maximizes their comfort. So here, what I want to point out is that imagine that this cow is a prepartum cow, but imagine that this stall is of poor quality, is wet, and is dirty. And actually, that's what they did in this experiment. They put water in these stalls here, and the only stall that is really dry and comfortable is this one here. The point that I want to make is that a cow will choose to lay down in a comfortable, dry stall. Okay, but if we are limiting the access to these stalls, then the time that the cow will be standing searching for it will increase. And what's worse, in some cases, the cow may actually decide just to lay down on concrete because it's just not comfortable enough to be on a stall, or because if she knows that if she lays down on a stall, she cannot get up. So the comfortable stall, the access to comfortable stalls will definitely have an impact on how much time these cows will spend lying down in a proper surface. So some of the things that improve the transition cow health, particularly management, we'll talk about the duration of the close-up period. We already talked about reproductive management and how important it is to make the cows conceive early. Comfort is important, particularly minimizing heat stress. Separation of cows and heifers, I'll talk about it, and then we'll talk about stocking density and regrouping. On the nutritional aspect of things, and I'm not going to talk about them because that's not the topic of the class, is maximizing dry matter intake in water. We talked about this, but then there is anionic salts or acidogenic salts to reduce the probability of hypocalcemia, feeding of monensin and choline to reduce the risk of ketosis, and feeding of fatty acids, omega-6 fatty acids, to help improve the immune system by having a little more of a pro-inflammatory status in the cow as they approach calving. These are the things in red that we know for a fact will have an impact in any dairy you go to, okay? So if you're meeting these things that are in red, then you can start thinking about everything, well, everything else. You will not solve problems of duration in the close-up, of heat stress, or lack of dry matter intake, or something like that, by adding monensin or acidogenic salts or anything like that. The important is the red, and then the rest comes as you meet those requirements. Okay, so the duration of the close-up period is important. And in most herds, cows are designed to stay in a close-up diet for 21 to 28 days. The physiological changes associated with calving and the start of colostrogenesis take place particularly in the close-up period. And during this period, because of these changes, in many herds, there are changes in the diet adjusting for calcium, phosphorus, potassium, and magnesium in the diet. And in many herds, there's also the feeding of negative difference cation anions in the diet, which is basically achieved by feeding acidogenic salts, okay? So it's a really critical period of the cow's prepartum phase. And so it's critical that the heifers and cows spend enough time in the close-up diets. So this is just to show you how bad the distribution of days in the close-up diet was in this herd. This is a herd that was in expansion since 2009. 32% of the heifers were purchased. And so a lot of the heifers, they did not know when they had been bred and when they had conceived. So you have only 26% of the heifers stay in the close-up from 31 to 31 days, which is really bad, okay? Now, the same herd, looking at the mature cows, look, it looks much better because it's 100% AI, pregnancy diagnosis is done by ultrasound, and there is precise information about the AI date and when the cow's conceived. So 60% of the cows stay in the close-up from 31 to 21 to 31 days of time. So the way to achieve this goal of keeping the cows in the close-up for enough time is based on the information you have about when the cow conceived, okay? That's really what it comes down to. The consequences of keeping the cows in the close-up for very little time are important. Here you're gonna have days in the close-up, and then here you have retained fetal membranes and you have metritis. The first lactation cows are in blue and the second and greater lactation cows are in orange. And you see that the lowest probability of retained placenta for both groups happens in this herd when the cows stayed in the close-up period or close-up diet for about 30 days. And then when you look at metritis, the lowest incidence for first lactation was somewhere around 25 days, and for mature cows, somewhere around 32 days. So at least in this data set from this herd, it would be ideal to keep first lactation cows and mature cows in the, or the heifers and the Paris cows in the close-up diet for about 30 days to 35 days. This is related to uterine health. When we look at pregnancy to first service, Here you see that independent of parity, the maximum probability of pregnancy at 31 and 66 days after first AI happened when the cows stayed in the close-up diet about 27 to 32 days, okay? And when we look at pregnancy by 305 days in milk, it seems that the time the cows stay in the close-up is more important than the time that the heifers stayed in the close-up. So you see that for cows that stayed in the close-up for about 27 days, nearly 80% of them conceived by 305 days in milk. But if they stay little time in the close-up diet, less than 60% of them conceived, okay? Finally, what we see is milk yield, okay? Or removal from the herd and then milk yield. Removal from the herd is a similar pattern for both paras and nulliparous cows, where the longer the paras cows stayed in the close-up, the less likely they are to be removed from the herd. And for nulliparous cows, it seems that if they stay in the close-up for about 30 days or so, they are less likely to be removed from the herd within 305 days in milk. As far as energy-corrected milk, the biggest impact is really on paras cows. And you see that if the cows stay somewhere around 30 days in the close-up diet, their production is maximum, close to 10 kilos or 22,000 pounds per lactation. These are Jersey cows. So this is a pretty significant difference of about 10,000 kilos down to 9,000 kilos, down to 8,000 kilos, as the number of days in the close-up diet goes down from 30 down to 20, down to 10 or so. Very important to keep in mind then that because the close-up diets have this increased net energy for lactation and crude protein, and often also include acidogenic salts, the cows have to stay in the close-up diet for at least 21 days and usually closer to 28 days, at least based on this data set and some data also from hosting cows produced by Jose Santos' lab. Okay, what about heat stress? Well, heat stress has a profound impact on the lactating cow, but we also now know that in the dry cow as well. So heat stress results in lower dry matter intake. Because they have lower dry matter intake, they have lower immune function, and they have more morbidity of diseases. Also, because of changes in metabolism, they end up mobilizing more amino acids, these prepartum cows, which could affect the regeneration of the mammary gland. And so if they have this mobilization of amino acids for other reasons, they have lower regeneration of the mammary gland and lower milk yield. And then finally, the bad thing for the calves is that colostrum of cows exposed to heat stress often has less IgG, and also the calves that are born have lower weight and viability. So ultimately, what you want to do for reducing heat stress in the periparturium period is to provide plenty of drinking water, shade, water to cool off the cows, like sprinklers like this, and then wind, like fans, like in this holding area, and then like here on top of the bedding, okay? So you want to make sure that they have plenty of water. There is no competition in the water trough like this. They have more access to drinking water, which helps them cool off. And make sure that you're soaking the cows wet with cool water so that that transfer of energy, of heat from the cow to the water is faster, okay, by having that direct contact of cold water against the skin. And then apply fans, ventilation, to make that air circulate faster. Obviously, here on the upper left and lower left, you have situations that are definitely less than ideal, okay? And it shows how important this can be here in Florida in particular. All right, what about separating cows and heifers? I'm only going to show you one slide, but this is a slide that tells a lot about the story here. In this study, what they have is mature cows housed with heifers prepartum, and then comparing to heifers housed alone, okay? And so what you have here is eating time, eating bouts, concentrate intake, silage intake, lying time, resting periods per day, and then ultimately milk yield kilos at 130 days of lactation. And what you see here is that when the heifers were housed with cows, they end up eating for a shorter period of time in the day, 21 fewer minutes. They have fewer eating bouts. They approach the bunk less often. They eat less concentrate, so 1.5 kilos less and zero 0.9 kilos less of silage. They lay down for fewer time or fewer minutes per day, about 37 fewer minutes per day. So they have fewer resting periods than the cows that are housed separately. And ultimately, the heifers that are housed with cows in the prepartum produce about 200 kilos less of milk in the first 130 days in milk. So the message here is, whenever possible, we need to have housing for the heifers that are approaching calving separate from the cows. And also postpartum, ideally, we should do that. We should try to separate first lactation animals from mature cows. So some of the things that help reduce the stress in periparturient dairy animals is separate cows and heifers because of this dominant issue, and because heifers will suffer when trying to find access to resources when they have mature cows around them. Regrouping, the most important thing is to minimize changes in diets. The changing of groups is less important, and we'll talk about it in a minute. Make sure that the cows have plenty of access to feed and water. So depending on the size of the cow and depending on the type of barn, or if it's headlocks or if it's post and rail, you have to have 27 to 36 inches of feed bunk space, okay? And in the prepartum pen, it's ideal to have less than 100% headlock capacity. I don't think that 80% has to be the goal, but having less than 100% seems to be ideal. Allow for approximately 3% left over and 2 to 5 inches of linear water trough per cow, with one water trough for every 20 cows, okay? And clean water, okay? The water has to be clean, otherwise cows will not be enticed to drink it. Okay, so let's talk about stocking density in the prepartum pen. This is one of the first studies to ever discuss how the prepartum pen stocking density could impact the next lactation of these cows. And this is a study that was done to evaluate a feed additive, not to evaluate stocking density. But what they found out after the study was concluded was that the range of stocking density in the prepartum was 62 to 138%, because the experiment took 7 months to complete, okay? Now, in the prepartum, nulliparous cows were grouped with parous cows, and actually in the postpartum too. So you have mixing of heifers with cows. Now, remember that if the experiment lasts 7 to 8 months, it means that some cows will be calving in the summer and some cows will be calving in the winter. And actually, the majority of the herds will have an increase in number of calvings starting in the spring through the summer, because of the difficulties of getting a cow pregnant in the previous summer, right? So since the cows have a 9-month lactation period and they end up conceiving in the fall, it's more likely that they will end up calving in the spring and summer of the next year. So there is a confounding here in this stocking density. That's what I'm trying to say. In this study, what they found was that for every 10 percentage point increase in stocking density above 80%, there was a loss in milk production in the heifers of 1.6 pounds per day. But again, this is a retrospective data with no control of changes in ration, season, and management. Now, it's important data though. So, but we were concerned, and in this one herd that we work with in Minnesota, they were actually trying to determine if they needed to increase the size of their close-up pens and the availability of space for close-up cows. So we actually did an experiment. We compared 80% headlock stocking density and 86% stalls, and 100% headlocks stocking density and 109% stalls. So we're going to what the idea would be of 80% compared to 100%, And here you have the herds. You have the stocking density based on headlocks and also based on the stalls that you have. So what did we find? We found no effect of stocking density on immune responses and metabolites. And when we look at primiparous and multiparous cows in the 80% stocking density versus the 100, when we look at retained fluid membranes, no difference, 2%, 6%, 8%, 9%. For metritis, no difference, 26, 26, 17, and 10. Endometritis, no differences. So for uterine diseases, reducing stocking density from 100 to 80% was not helpful. When looking at mastitis by 60 days in milk, no difference. Lameness by 56 days in milk, no difference. Removal from the herd by 60 days in milk, no difference, about 5%, 5 to 7%. And then pregnancy to first service, also no difference, okay? 3742, 3746, and fat corrected milk up to 150 days in milk, no difference either. 30 kilos per day, 29, 39, and 39. So ultimately, when we look at this experiment, we can conclude that by providing 100% stocking density in the prepartum pen, when cows and heifers are kept separate, we do not affect their performance compared to 80% stocking density. Now, regrouping is another issue that people have discussed and suggested it's important to the health of transition cows. This is probably one of the first studies to evaluate how moving a cow from one group to the next affects their behavior and production. And in this case, what they have is a test pen, and then they have a source pen. So this would be a test pen, and they get one cow from the source pen and move that one cow into the test pen. And then they observe this cow 3 days before and 4 days after the pen change. And what they found in this study was that when the cow was moved, there was a reduced feeding time in the first hour after the pen change. There was also an increase in the number of displacements from the feed buck in the first day after regrouping. So you can see that this cow remained, let's say, passive for the most part because she didn't initiate more confrontation, but she was confronted more often by other pen mates after she was moved. So this is the day of the move, 1 day after, and then 2 days after. But this really only lasted for the first 24 hours. There was a reduced resting time of 3 hours in the first day after regrouping, and there was a reduced milk yield on the day of regrouping. So yes, when you move one cow to a new pen, perhaps there are some changes in behavior and even in milk production, but they are short-lived. It's first hour, first day on the day of. So even though these changes may happen when you move one cow to a new pen, the changes are short-lived, and in most herds, you don't move one cow to a next pen. You move a group of cows from one pen to the next. So we don't know how important this really is. The idea is that when you have a all-in, all-out system, you have only a transient disturbance of the pen when you have that initial movement, but then because you're not bringing new cows in, you kind of keep that social instability stable. And then whenever you empty that pen and bring a new pen in or a new group in, then you have that unstable situation, and then you have another plateau. Now, if you have a conventional system with continued regrouping of cows, the theory is that you never allow the cows to have that plateau of social stability. So theoretically, you would always keep the cows under more social stress, which some people were claiming that would compromise the health of the cows. And so there were actually dairy consultants suggesting that the herds should adopt this all-in, all-out system for prepartum cows because of this data showing that when there was a cow movement, there was a chance of these cows having these disturbances in behavior and production. But the question is that possible in a commercial setup? So we did this experiment. We have here on the left side what we call an all-in, all-out group. And you can see the very last cow of that group. And so imagine that you're subutilizing a very costly pen of cows, okay? So we compare this all in, all out versus a conventional strategy. So where in the all in, all out, you expect or you wait for one pen to empty and then bring a new group of cows in. For the conventional, as the cows are being moved because they calved, you just fill them up as there is space. So the all in, all out will reduce social disruption, increase dry matter intake and health, but we also have to understand that it reduces stocking density, as you can see by this picture here, and would therefore increase the cost of building. The question then is, does the regrouping affect the health of the cows? Well, it had no impact on immune parameters or responses in metabolites, and also it had no effect on uterine diseases like retained placenta metritis and acute metritis. You can see that they're very close, okay, 11%, 17 to 20, and then about 3%. No effect on DA, no effect on removal by 60 days in milk, no effect on reproduction measured by cyclicity at 53 days in milk and pregnancy to first service, and also no effect on energy corrected milk. So based on this data from Jersey cows, mature cows, we can say that regrouping does not have a negative effect on these cows. Okay, so to summarize some of the things that we look for in monitoring transition cows before we go actually into the monitoring itself, some of the strategies that we use. Here are some guidelines that you can use to evaluate herds. So body condition score at dry off, 275 to 325, calving 3.5 to 375, and at 60 days in milk, 275 to 325. You don't want the cows to lose more than 0.75 units of body condition from calving to 60 days in milk. BHBA is not something that people use a lot for prepartum evaluation, but in the postpartum, yes. So when you do a postpartum evaluation of BHBA of a group of cows, and you have more than 25% of the cows with BHBA above 1,400 micromole per liter, that group of cows or that herd is expected to have a odds ratio of displacement of abomasum of 2.1 compared to herds that don't have this many cows with high BHBA. So the point is that if you have a large proportion of cows with high BHBA, the risk of displacement of abomasum for those cows increase. Calcium is something difficult to measure, but there are some data that show that 1 week postpartum, if you have more than 35% of cows with less than 2.1 millimole of calcium, you could have an increase in the odds ratio of displacement of abomasum of 2.4. And if you have more than 15% of the cows with calcium below 2.1, you can have a drop in milk yield of 3.8. Uterine pH is something very useful to monitor, particularly if you're feeding a ketogenic diet. And we can talk about that if you guys have questions about it. And then NIFA is something useful as well. 1 week prepartum, if you have more than 30% of cows with NIFA above 0.5 milliequivalents per liter, you can expect that that herd is losing about 3 kilos per day of milk yield, okay? Those are things that you can use to monitor your cows. Now, the actual monitoring of cows. There are some herds that have maximum intervention, and they do monitoring of the dry matter intake of groups prepartum. They monitor calving every half an hour to 2 hours. They monitor urine pH if they're feeding a ketogenic diet. Group dry matter intake is monitored postpartum, and daily changes in milk yield is also monitored, which is something very useful. And then there's daily observation of udder feel, attitude, and vaginal discharge. These are options that can be adopted by any herd, but the herds that are also adopting physical exams at different time points postpartum, like 4, 7, and 10 days, and also rectal temperatures of every cow daily up to 10 days in milk, they are very intense, but they can only be done in herds that are relatively small, because checking daily rectal temperature takes a long time. And you have to remember that daily rectal temperature is not pathognomonic to any disease. Okay, and also that high rectal temperature does not necessarily mean that there's an infection, particularly in the first 2 or 3 days postpartum, because sometimes it's just local inflammation that is increasing the rectal temperature. Moderate interventions, larger herds eliminate the use of the rectal temperature. And then minimum interventions, there are herds that are not doing anything, and they basically only go by the observation of the cows on udder feel, attitude, vaginal discharge, and that's it. Now, for these herds in particular, there is maybe an opportunity in the future for using automated systems like monitors of rumination, activity, and resting. Those could possibly help with monitoring these cows. So I just want to go over some of the very important things that we monitor, and people that are good at looking at cows can see a cow that is sick very quickly. Cows have to be aggressive at the feed bunk when fresh feed is delivered in front of them. And particularly when they come back from the parlor, they should go to the feed bunk and eat if there's fresh feed in front of them. That is the expected attitude of a cow. So on the left here, I just want to show you the cows are returning from the parlor. You can see that the cows are walking calmly. These are Jersey cows on a cross-ventilated barn. And as the cows are approaching the pen, they basically, what I want to show you is look at what the cows do as they enter the pen. Okay, so look, the cow is walking very certainly here to find a spot in the feed manger, in the feed bunk to eat. And you can see how fast the first thing they do is they don't even look at water. They go straight into the feed bunk and start accessing the fresh feed in front of them. The other thing I wanted to point out is that a cow that has this much feed gone in front of them is a cow that's being very aggressive at the feed bunk. And you expect this from a cow. Okay, you can see that this cow is actually now searching for concentrate. She's sorting through the diet after having eaten a lot of it. Okay, now a cow that comes back from the parlor and goes straight into the stall and doesn't go to the feed bunk is a cow that should be looked at, is a cow that has an attitude problem. What I wanted to point out to you here is this. This is a pen that has just been bred, and you can see that the cows are being let go. Look at this cow here. First thing she's going to do is she's not going to even look at me. She goes straight into the stall and she wants to just rest because this cow just came back from the parlor and was locked up for about 20 minutes, 30 minutes. So the cows cannot be locked up for too long to the point that it would prevent them from having access to a resting surface like a stall. And also, you do not want to prevent the cows from accessing other resources like these cows are trying to do here, which is to access the water trough, okay? So you want to make sure that whatever you're doing to transition cows does not keep them from doing what they're supposed to, which is resting, drinking water, and drinking and eating feed. Okay, so I'm going to talk very briefly here about the association of daily milk yield and metabolic and infectious diseases. And here you have the milk yield of cows that are healthy and cows that have metabolic diseases and cows that have uterine diseases and healthy cows. So the point here is that daily milk yield can be used as a sign that the cow is having trouble, particularly when we talk about metabolic diseases. And you can see here that a cow that is diagnosed with the metabolic disease at day 0 actually already has lower milk yield quite a few days earlier and continues to have lower milk yield than healthy cows. And the same is for uterine diseases, even though the difference is not as dramatic. Obviously, rumination is something else that can be used. And you can see here the rumination of a healthy cow is quite high, and for a cow that has metabolic diseases is lower. And the same is for the cow with uterine disease. So it's a lower rumination. My point here is that technology is available and has been available for a long time that can help us find the cows that are sick, either by daily milk yield and now more commonly with rumination systems and so forth. There is no perfect way to do it, but there's plenty of ways to do it. What I wanted to point out also is this, that here you have what I wanted to point out then is that, you know, you don't have to buy expensive equipment to monitor cows. Okay, daily milk yield is something that's been available for a long time, and it's probably very good compared to other newer systems like rumination and so forth. The point here that I want to make is this: when you look at the percentage of rumination and activity alerts that are preceded by a milk deviation alert is close to 45%. But the percentage of milk deviation alerts that are preceded by rumination and activity alerts is only 20%. So perhaps milk deviation is quite correlated and probably precedes some of these rumination alerts here. That's the point. The other point is that the alerts, either milk deviation and rumination, they precede, they're preceding diagnosis of diseases in 50% of the time. So when you have an alert, it's preceding the diagnosis of disease in 50% of the time. Okay. Now, diagnosis succeeding the alert. So you have that the percentage of alerts that are followed by the diagnosis of disease is about, for milk deviation, 30%, and for rumination alert is about 50%. So the two systems work, and it doesn't have to be one or the other, or actually it can be one or the other. It doesn't have to be two together. So the rumination system is something that most of you are familiar with, and they basically monitor rumination every 2 hours, and then it gives a standard line here comparing this point in time to the same cow in the previous few days. Okay, it's something useful. Here you have a normal cow that has rumination, a drop, and then an increase. Here you have a cow that was diagnosed with metritis. She has a significant drop, and the rumination never really catches up. And here you have a cow with displacement of mesum, where there's a big decrease, and she really never recuperated that well. What I want to point out is that decreasing rumination is not pathognomonic. Okay, so a cow that has retained placenta has reduced rumination. A cow that has hypocalcemia has reduced rumination. A cow that has metritis has low rumination, and a cow that has ketosis has low rumination. There is no certainty about what disease it is, so you need to still evaluate the cow. That's the first thing. And so it's critical to keep in mind that this is just another tool and not necessarily something mandatory for a herd.